Hi everybody, it's Karen the Virtual Midwife. There's a few new ladies in the group who have joined since the last time I posted a video. So welcome to you. A few of you are due in the next few months, so this one will be particularly pertinent for you because I'm going to be chatting a little bit about episiotomies. Now, if you don't know what an episiotomy is, it is basically a surgical incision or a cut that is made into the perineal tissue, so the tissue between the vagina and the anus, and it's made to widen or open the birth canal more to allow easier birth of your baby. Now, when that's medically indicated, it's a great intervention, but like all medical interventions, if it's not medically indicated and it's done for the wrong reasons, we don't want to do it. Okay. Unfortunately, there is a huge culture of doing routine episiotomies, so that means doing it routinely regardless of whether you need it or not, and that's what I want to talk to you more about today, because if at all possible, that's what you would like to avoid. But in order to avoid any intervention that is not necessary, you need to understand what it is, why it's done, and how you can avoid it. The thing with an episiotomy is that it is not necessarily painful when it happens, but it's the recovery is painful, and it's not always necessary. It's a very outdated practice, and it has increased in that they're doing more of them, mainly for a need for speed, because if you're having your baby in a hospital, unfortunately, the reality of hospitals is that time is money, it's a business, and if they can speed up the process at all using any means or matter, that will be one of the things that is done to speed up the birth of the baby. And personally, I don't know why, because it actually doesn't make sense. It may speed up the birth of the baby, but the suturing and repair of the episiotomy takes roughly 10 to 15 minutes, and those 10 to 15 minutes would have been more effective and better used by just waiting and allowing your baby to come down at their own time and using your own efforts, either of directed breathing, birth breathing, or good bearing down if you have that strong urge to push. The fact is that episiotomy is like I said, a practice that started over 300 years ago. And when it started 300 years ago, it was believed to be beneficial, or more beneficial than a natural tear that might occur. It was seen to cause less damage and to protect the pelvic floor. Now, we know since doing research that that is not the case. However, the practice continues. Like many outdated practices, this is one that has continued. Having a discussion with your care provider about episiotomies can seem gross, it can be really uncomfortable, but it is something that is vital. If you want to avoid one, you need to have that discussion with your obstetrician or whoever you've chosen to be your care provider. Now, if you are having your baby in a hospital setting, then it will probably be your obstetrician, but that doesn't mean to say you shouldn't be chatting to the midwives who are looking after you. But the decision the conversation needs to be done during pregnancy, not during your birth, because an episiotomy is usually done in the moments before birth or while your baby is actually being born. Okay, so it is the end of your labor. You may have been in labor for hours, you're tired, you're extremely vulnerable, you want your baby to be born. It's not the time when you want to be engaging in a conversation, in a negotiation, in a discussion, or even in any form of confrontation. And you certainly don't want your partner to be involved in that, because it is such a beautiful, intimate moment. You're about to meet your baby. And there's a possibility that in that moment, if an episiotomy is framed as it being quicker, you'll actually welcome it. So you really do need to understand why it's done, when it's done, and make sure that your care provider is on your side and understands your need and your desire to prevent it. Make sure what their practice is, and if their practice is to do it routinely, either convince them that for you would like that to be different, or possibly consider changing your care provider, because it's a very outdated practice to do it routinely. So, if that's one of the outdated practices that they are still using, what other outdated practices are still present? Especially if it's not going to do anything that will improve the health and safety of either you and your baby. And remember, it's more the long-term effects of having an unnecessary episiotomy that we are talking about right now, and the long-term effects of having one that is either done and that doesn't heal well, or that is extremely painful, or that is repaired incorrectly or not well, is that you may end up having painful sex afterwards, a lot of self-image and just self-doubt. What's going on down there doesn't look the same as it did before, and just possibly, if depending on how it all happens, the psychological impacts of something that was done either against your will or without you even knowing. And I think that's probably the worst one, is that it should never be done without your consent, or at least of informing you of what's going to be done. And that's why it's so important that you have that discussion with your care provider during the pregnancy, so that you can really go through all of these questions and have a really open discussion about their practice, about your wishes, and what you're going to do. Because there's two aspects to this whole thing. One is your preparation. There's a lot that you can do to prevent having an episiotomy, and it's very important that you do that, and specifically in those last weeks of your pregnancy, so from 34 weeks onwards, definitely up until then, but those last 6 weeks are incredibly important in using all the exercises that I teach you to prevent an episiotomy. But the second part is making sure that your care provider is going to honor those wishes and work with you with the understanding that you really have done your part, and now you're handing over, because in that moment you are really putting a lot of your trust into your care provider to work together with you to make sure that an episiotomy is not done unless it's absolutely necessary. I'm going to end this video here today. I probably left you with quite a few unanswered questions, so I welcome those questions, and I'm going to do a little poll that I would love you to fill in, having watched and listened to this. And feel free to send me a direct message if it feels a little bit vulnerable to post in the group. Absolutely fine with that, but bear in mind that this group is all ladies, they're all pregnant, and probably feeling the same as you, and experience the same doubts and challenges and fears around this. So it'll be nice if you can see that you do all have those, and I really want to get a good idea of where you are on this journey. If it's something that you've never heard of before, and I'm kind of like throwing something completely new at you, or if you've heard of it but you weren't quite sure how it worked and what you could do, or if you could avoid it. If it was something that you just thought, listen, it's part of childbirth, everybody else has had it done and I kind of just have to get my head around it, or if it's something that you actively want to do something about to try and avoid. So those are all the kinds of things that I want to know, because I am putting together something that will really help you with that. So thank you. Post those questions, post your comments. I look forward to hearing all of that, and then let's do this.